Heroin. It has touched the lives of every American. One would be hard-pressed to find a person who does not know of someone who has overdosed from heroin or other opiates, or is suffering from heroin-opiate addiction. Heroin can be found in our cities, suburbs, and rural areas. For the period 2004 to 2014, there have been 5,217 heroin-related deaths in New Jersey. Since 2015, over 184,000 people have been admitted to a New Jersey substance abuse treatment facility for heroin or opioid abuse. In 2015 alone, more than 28,000 have sought treatment in New Jersey for heroin or opioid abuse, outpacing any previous year's figures. According to treatment experts, the figures no longer accurately represent the scope of the problem, since the need for treatment far outpaces what is available in New Jersey. But what is heroin addiction? How does it affect the human brain? The National Institute on Alcohol Abuse and Alcoholism defines drug addiction as a brain disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. The initial decision to take drugs is voluntary for most people, but repeated drug use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urges to take drugs. These brain changes can be persistent, which is why drug addiction is considered a relapsing disease. People in recovery from drug use disorders are at an increased risk for returning to drug use even after years of not taking the drug. Our contact family has also been affected by this heroin epidemic, and so we set out to try to understand this disease. We interviewed people in recovery to learn more about their struggle, what led to their addiction, and most importantly, what's keeping them from relapsing. Their stories cover every walk of life. Their ages range from early 20s to mid-60s. They're both men and women. In this group, the most common denominator was that they all started using drugs recreationally at an early age. But while their peers outgrew the desire to do drugs, they could not stop using, leading them into a downward spiral, losing friends, family, jobs, money, and in some cases, even their freedom.
My mom was a big enabler, and I was a good manipulator and played the victim all the time.
I stole everything, and my family made it easy for me to take.
In my addiction, I became a compulsive liar.
I had a grandma. She was like my biggest enabler. I bullshit her. I manipulated her. I'm going to do good. I'm going to do good. She let me move in with her.
I went to Alcoholics Anonymous, and it changed my life.
And man, thank God for my sponsor.
My father was in prison. He was a heroin addict. He had a lot of issues.
In 1994, my brother died of a heroin overdose. In 1980, my father died in a mental institution from drinking himself to death.
When I was 15, I watched my mom get run over by a drunk driver and killed her instantly. And that kind of set it off because I moved in with a friend and his mom was a bartender, so we just, it was like the three kids around the same age as me, and we just ran reckless.
So I would sneak downstairs in the basement, and some of my uncle's friends would give me the end of their beer, watch me get drunk, and think it was hilarious. I was about 6 or 7.
I started doing drugs on a daily basis when I was 14. I started drinking on a daily basis before I was 16. And the first time I put a needle in my arm, I was 16, and it was heroin.
I started out around 12, 13, stealing things from mom's liquor cabinet, hanging out with friends.
My generation, for me, was about music, and it was about escape. Escape reality, escape the reality of the Vietnam War, escape the reality of being in the draft, escape my home life.
The addict doesn't stop. The addict thinks, if I can feel this good, I can feel better. And then it just gets to a point where you just lost the ability to tell you're too far gone.
Addiction is a way to get out of myself and not deal with my feelings. I feel like addiction it's a mental disease.
Self-medicating to feel better, to not think about something. When I took my first drink, it just never left. I was bigger, I was taller, I was prettier. Yeah, why wouldn't I chase that?
I was put in my first rehab in high school.
I mean, I went to treatment 15 times. I went to jail for 8 months.
Rehabs are terrible. How would I change it? I don't know. Make it more long-term and more serious?
I've done, I think, 5 rehabs. It only works if you want it. That's all I can say.
Heroin is the scourge of the 21st century. In 2016, more people died from heroin-related causes than from homicides. The U.S., which makes up about 4% of the world's population, consumes 80% of the world's opioid supply. Now, the mortality rate from drug overdoses is rising faster than gun deaths and other causes of death in America. These increases contribute to the first decline in American life expectancy since 1993. Mortality disproportionately affects rural areas as compared to urban areas. In New Jersey and Pennsylvania, the average age of fatal overdose is 39. On December 13, 2016, the 21st Century Cures Act was signed into law, allocating $1 billion to combat opioid addiction. The money will be granted to states to fund improvements to prescription drug monitoring programs, prevention programs and research on prevention strategies, training to teach prescribers to follow opioid prescribing guidelines, learn to safely manage pain, and refer patients to treatment, expanded access to addiction treatment, and other public health activities to combat the opioid crisis. Drug addiction and death from drug overdose are preventable. Together, we can bring an end to this epidemic by taking a few steps, such as 1. Destigmatizing addiction. Addiction is a chronic brain disorder and not simply a behavior problem. It is not a choice. No one chooses to be an addict. According to Dr. Michael Miller, the disease is about brains, not drugs. It's about underlying neurology, not outward actions. 2. Increase the availability and affordability of good, reputable drug treatment programs, using a holistic approach to treating addiction and investing in new research on how to cure or manage addictions. 3. Cracking down on doctors who are prescribing large quantities of narcotics, pill mills, using state drug monitoring programs to identify these doctors and to empower pharmacists with a mechanism to flag those who are doctor shopping. 4. Educating physicians to recognize addictions in their patients and to use caution when prescribing opioid painkillers. And 5. Educating families, their children, and the community about drug addiction and how to prevent it. Together, we can make a difference. Educate yourself on the signs of drug abuse and on how to prevent it for ourselves and for our loved ones.